unlimited or take restrictions off transfers between major and local roads to use our Act 51 funds. So we have to have this program in place in order to be able to do that.
Yeah, and to back up, so back in 2008, through the Public Act 199, the city was required to put together an asset management plan. Part of the benefits of that was, what the mayor just alluded to, allowing you to use your major dollars on your local streets. So the city put together the asset management plan that included a pacer rating of the entire road system. What we're going to be doing today is, or what this is also, is update that to today's visual analysis of the road conditions.
Updating those ones that have been repaired to date since the last time it was done, and then ones that have deteriorated further since.
And allows the city to continue to use their major dollars on their local roads.
And is this paid out of Act 51 too, for you to do the work? Okay.
Plus, it'll allow us to reprioritize those areas that need to be addressed. I mean, right now, we've been operating off of the PACE program from back from the very first as to what roads need to be addressed at what point in time. So now that we do it again, I mean, some roads, for whatever reason, they have deteriorated, faster than other ones based on whether they were, what is it, 1 to 8 or something in the rating, or
1 to 10.
1 to 10. So, something might have been a 4 or 5, and something might have been a 6 or 7, and now all of a sudden, 4 or 5 is down in 8 bad or 8 good.
8 is bad.
Yeah. So it's deteriorates a little bit faster than whatever reason something happens. So.
Okay. Any questions on that, folks? We'll go to 14. This is HR item for CIC. I don't know if you call it sick.
CIC.
That sounds better.
I don't
For
think
health.
Jen wants us to call
I know,
it.
right? All right.
It's $18 per active employee contract per month. Sounds like there's a lot of money. What's the total budget?
Yeah, this is to replace the services that MEDS is providing to us for $25 a month. So monthly, to manage our HRA and process our claims, we pay about $9,500 to MEDS. With the transition to CIC, it'd be around $6,800. So it's a annual savings of about $32,000 for this fiscal year, because we're only about 11 months able to make that savings. It would be about $30,000.
What does CIC stand for? Or just CIC?
Cadillac Insurance.
Oh, okay, well then, who will we pay $9,500 to?
MEPS.
And when Blue Cross was still doing the administering, or whatever it is, what did they cost?
Blue Cross has never done our administrating because for the inception of our HRA, we've only had MEPS.
Okay, I'm going back to my days. Okay, thank you. Who did it before CIC? Before Cadillac?
MEBS did it, but the Blue Cross Blue Shield is still your health insurance
Yes.
administrator. The HRA is just a component we're using for cost savings. So it's actually a mechanism to reimburse a deductible gap, and that's the administration fee.
In April of 2012, this council approved MEPS to become the administrators for our health reimbursement account. The health reimbursement account allows us to process the claims from the high deductible plans that we purchased to lower our costs that we're spending on health care. So something that we said that we were going to do after about a year into it, we were going to evaluate the claims, we were going to evaluate what we were spending with MEBS, we were going to evaluate the service. And at this time, we have talked to CIC. Our employees, our retirees already work with CIC. MEBS was kind of like the middleman anyways, so this is kind of taking out a step for the employees. Things that we like about CIC is that they have a 24/7 service line for our employees and retirees. with MEPS, we could only have people call Monday through Friday, 9 to 5. The CIC offers a 24/7 service, so whatever their issues are, whether it be evenings or weekends, there's coverage. Another benefit to moving to CIC is that we will be able to process claims weekly versus processing them every month. So there's going to be a better turnaround time for claims, so employees will feel like they're going to see less bills come to them or less crossing wires between the provider and the processing of the HRA claim. And one of the things too that we had to do with MEBS was we had to pre-fund to a certain dollar amount each month, and we no longer have to do that with CIC. So for us, MEBS, we don't have to keep balances of money in the HRA. It's basically a process in, process out, and it's on a weekly basis, which allows us once again to just exactly put into that account what we need to pay the existing claims.
And then CIC is, ABS is CIC.
Yeah,
Okay.
actually, the corporate name is ABS, doing business as CIC Benefit Consulting Group.
Because in the minutia, I've seen ABS a couple of times, and
Alphabet Soup.
I understand that. Thank you.
Anything else? All right, thank you. Everyone involved? Thank you. Next, we'll go to the judiciary proceeding coverage.
This is a policy that was requested by the judges. They had inquired it with regard to their judicial disciplinary proceeding coverage through conversation with the court, with Vicki Bowman, with both of the judges. It was determined that we had a policy that was in effect in '02. I believe it was with St. Paul. Steve, do you remember? I can't remember if that was the St. Paul policy or if that was the '06, but we did have a policy years ago. In 2006, Mr. Riddle had provided a letter to the judges saying that they were no longer going to carry the policy. They were just going to cover this coverage under our self-insured reimbursement amounts. So basically, our general liability coverage covers wrongful terminations, discrimination, harassment, slip and falls, anything with a city vehicle. The gap that we're covering with this particular policy is really for any type of civil complaints that would be brought against the judges while they are serving on the bench. So if for some reason that a third party filed a complaint with the Attorney General's office or filed a civil matter, this would indeed cover them, and it kind of closes all of the components of the liability. On the rate sheets, you'll see that there were different coverages that were listed, A, B, C, and D. Currently, we have coverage through our general liability for A, B, and D. This is just to purchase the disciplinary proceeding coverage, and so it's coverage C only. And it's on two of our judges that are sitting, and these are annual premiums. And Steve Staff Jr. is here if you have any other questions. He helped us put out to market and to determine what policies were out there that we could fill that gap with.
Essentially, it's a liability insurance.
Correct.
Quick question, has nothing to do with the judges. I asked a question some time ago when our auxiliary officer was killed. Have we started any type of insurance on those guys, liability insurance or anything?
Yes, we just had some discussion at our last risk management meeting, and Steve and Bob that were here a couple meetings ago when they talked about our general liability insurance, we've had some discussions about how we could go forward with that. So there are
Protecting them and the city?
correct. There are some state statutes that kind of drive what would be needed with such a volunteer program, but we are currently in conversations about looking into that.
Guys are carrying them without insurance.
So on this, though, can I ask a question? So we had something like this before, we thought they were covered under some other umbrella, and now.
Many years, well, in 2002, we had a policy, and then there was another policy in